We represent alcohol and drug treatment facilities. We do verification of benefits, utilization review, national contracting. We do the utilization reviews, we do the clinical management of the benefits so that patients can get covered. And then we bill and we receive the money. I started 20 years ago in a room by myself. I found the need to help patients because insurance companies were managing benefits. They wouldn't pay benefits because what they thought of mental health and substance abuse was not like if you had cancer. It's like if you're a deviant human being. And my father was an alcoholic, and I watched him die. And I was a nurse at that time. And at that moment, I decided to fight insurance companies to get the people the help that they needed. Well, because of Obamacare and especially parity, which I was instrumental in helping it. I worked with Patrick Kennedy, and I also work with with Congress. We work with Congress because now that parity has been enforced, parity means that mental health and substance abuse benefits need to be treated like major medical. So when insurance companies found that that was going to happen, they started to clinically manage the benefits. So a patient would meet criteria, ASAM criteria, to receive the treatment, and what happens is they say they don't meet the criteria, which is unfortunate. So I have a group of PsyDs, licensed mental health counselors. We work with ASAM and Milliman criteria. Also Aetna and Cigna and Magellan has their own criteria. The government saw that mental health and substance abuse benefit was not being covered. So what they did is they passed a law, which is the Parity Act. And when they passed the Parity Act, mental health and substance abuse was treated as any other illness. So they couldn't put day maxes or dollar limitations. Well, when insurance companies found out that they were doing that, they started to clinically manage the benefits. So even though patients met criteria for those levels of care, detox, residential, they wouldn't pre-certify the stay. So what I've been doing is we record all our calls. We have PsyDs, licensed mental health counselors, and we work with the lobbyists in Washington, D.C. to assure that the insurance companies are unable to clinically manage the benefits. Over the years, MedPro has expanded. We started out just doing billing and collections, and then I found the need that the facilities were having difficulty getting verification of benefits, or at least getting the correct one. Because it's such a small benefit and it's one that's not readily used, that they would be misquoted benefits. So what MedPro does is we not only verify the benefits online, we speak with a representative. And we have a database of over 20 years of experience that we're able to pull up to confirm those benefits. After we verify the benefits, the facility will send us the clinical paperwork on the client, and we will call the managed care companies to certify the stay. The reason that a lot of the facilities have utilized MedPro services to do the utilization review is because they're unable to fight the insurance companies. You know, they say they use ASAM criteria, and Milliman, Aetna has their own criteria. But what happens is, since parity's been put in place, they've been clinically managing the benefits so strictly that it's impossible to get the care that the clients need. So I have a team at MedPro that not only knows the ins and outs of the managed care companies, they know how to fight the fight. And that's really all that it is. We're patient advocates. Well, depending on the insurance carrier, Aetna has their own set of rules, Magellan has their own set of rules. We even know the individual case managers within the various insurance companies. There's one in New Jersey, you know, that we know, you have to tell her this. And there's another one in Aetna. And, you know, so what we do is we get the ammunition based on the clinicals in order to get the patients stay certified and make sure that we maximize their stay. The highest level of care is detoxification. When a patient is on a drug that needs detox, the patient needs 24-hour supervision, and detox is an intensive level of care. So the patient may get anywhere between, say, 4 to 10 days of detoxification. Afterwards, there's an inpatient level of care. That's less restrictive than detox, but they're not ready for the residential level. Then we step them down to residential. At residential, we try to get anywhere between a week to 3 weeks of residential, but since parity again has been passed, it's very difficult to get residential pre-certified. And we have always utilized partial and intensive outpatient. We've scholarshiped the room and board, and we just charge for the day services, because partial is residential without room and board, and intensive outpatient is a half a day of partial. So utilizing the continuum of care, we can usually get anywhere between 30 to 45 days for that client. Unfortunately, what's happening now is the insurance carriers are not letting us utilize partial and intensive outpatient when the patient is in a residential level. So what MedPro is doing, we are clinically critiquing the charts and administratively critiquing the charts, utilizing the state guidelines, federal guidelines, and the guidelines of the insurance companies to assure the patients get the treatment they need. Well, I never wanted to put anyone else down, but MedPro started 20 years ago. Most of the competition has either worked for me in some capacity, some answered my phones, and it doesn't mean that they wouldn't do a good job. But I don't believe that they have the patients and the client's needs. No, that's not the right thing to say. Okay. Let's try again.
So instead of
okay. What sets MedPro apart? What sets MedPro apart is over 20 years experience. I've been fighting this fight for over 20 years. A lot of my competition says they have over 20 years experience. I have the lines on my face to prove it. No. I am tenacious. I know the industry. People respect me. And I don't take no for an answer. I go to the highest level. I was instrumental in having Florida Blue Cross Blue Shield pay provider. They paid my providers before they ever paid providers. I flew to Michigan, who would not pay out-of-network clients. They not only pay my clients, but they pay them directly. I fight the fight. My competition, I'm sure that they are adequate. It's kind of like having AAA versus the big league. MedPro's here to fight the fight. MedPro's been in business for over 20 years. Not only do we keep on top of the standards, we make them. Insurance companies continually put roadblocks up, and we continually jump over them. So what MedPro does for our clients is we look in the future as what's coming. We don't wait to put fires out. Access came to me 5 years ago. I was at a conference, and I believe every conference has hit its place, but they really weren't dealing with the issues. The ever-changing field, the ever-changing landscape that is in our field. I wanted to empower not only my clients, but the industry. I feel that we need to come together because they're trying to separate and conquer. Together, we can find ways around the roadblocks, and the insurance companies continue, we can find ways around the roadblocks that the insurance companies continue to put up. My vision was to get all of the executives together, to listen to their needs, their concerns, to bring the top people from Congress, the top attorneys, from the insurance carriers, and to work together for a common goal. I believe Access will give you the tools. You'll go back to your facilities or your practices, and you'll be able to maneuver through the ever-changing landscape. What's happening is, because of all the new regulations, whether it be in urinalysis, the levels of care, clinical criteria, allowables, we're trying to give not only my clients, but every individual that comes here, the ammunition to move forward and to treat patients. My vision with Access was to bring the executives together. Each one brings their own individuality and their own knowledge. But together, if we share our knowledge, we can help bring the industry to the next level. We can eliminate what's going on with the managed care companies, with the allowables. Knowledge is power. And I believe that we learn something every day. And each one of us that are here, while we sit down at round table discussions and we discuss the challenges that we are facing today, we can take something from each and every one of the executives and bring it back to our facilities and practices and help forge ahead.